Thanks, Steve. Yes, I've done my acknowledgement. So I'd also like to recognise the significance of this week, Reconciliation Week. It's a week that's bookended by some really significant dates in the relationship of First Nations Australians and settler government. It's about some really significant legislation and policy changes for First Nations Australians and their relationship with non-Indigenous Australia. And 5 years ago, the Uluru Summit was on the 50th anniversary of the date that is the start of Reconciliation Week, which was the date of the 1967 referendum where Aboriginal people were no longer excluded from the census and the federal government were able to make legislation towards them. And I just think that this year's theme is actually really important, that we need to be brave and start making some changes that acknowledge the past so that we can heal and move towards a stronger future together. So today, as Steve mentioned, I am presenting some of the findings of my almost complete PhD study. This work commenced in February 2019 and is funded by the Centre for Research Excellence in Indigenous Health and Alcohol. I use the term First Nations Australians to recognise the diversity of all the nations that were living in this land that we now call Australia prior to British arrival and subsequent colonisation. And this presentation is also doubling as a milestone requirement for the university, so there are a couple of slides at the end that are relevant to that. So firstly, why is this important? Health is more than the physical wellbeing of an individual. It's also the social, emotional and cultural wellbeing of the whole community in which each individual lives. Decision-making power is important for good health and wellbeing. Some would say essential. And in 2007, the United Nations Declaration on the Rights of the Indigenous People recognised that Indigenous peoples have the right to determine their own status politically and pursue social, economic and cultural development. However, these pathways for First Nations Australians to contribute to policy development are almost non-existent. First Nations Australians actually have a really strong history of responding to health and alcohol issues, including, however, their inclusion in the policy development process varies. So I want to explore how we could determine how self-determination could be a part of the process in the development and implementation of alcohol policies, focusing on the Northern Territory. Unfortunately, I don't have enough time to explain the alcohol policy context in the Northern Territory at the moment. However, it's just important to note that almost 70% of First Nations Territorians are subject to additional alcohol policies that were introduced in 2007 under the Northern Territory National Emergency Response and continue under the Stronger Futures in the NT. And these measures overrode any existing locally developed measures that community had led. And this legislation is actually right in the process of changing. About 2 weeks ago, the Northern Territory government made some amendments because the sunset clause is coming to effect in, I believe it's July this year. But this context, I think, is still really relevant. So this study, as I mentioned earlier, began in February 2019, and the last paper and chapter was submitted in April 2022. There are 4 main studies, each building on the work of the previous one. I don't have a lot of time to provide really detailed methods on each study, so I'll provide a snapshot here to start. So don't worry, I know this is small. There are 6 objectives across the 4 studies, but I'll discuss these later. And methods, there were 3 key stages in data collection. A critical literature review examining the international evidence of and looking for models of Indigenous peoples' inclusion in policy. A Delphi study with a panel of 20 experts that was used to identify elements necessary for self-determination in health and alcohol policy development, and this is being used to create a framework. And then these were then supported by semi-structured yarns with 24 people that focus from Central Australia that focused on alcohol and First Nation Australians' leadership in these processes. And these were analysed in two different ways, thematically and against the framework. So there have been two papers published, one in the International Journal of Drug Policy and one in Health Research Policy and Systems. So this is what you can go for extra detail. And the other two papers are currently under review and will be accessible via the NDRI website or the Centre for Research Excellence website, which is gathering.edu.au once accepted and published. So self-determination has many different understandings and it really depends on the context. So based on that early on, we defined self-determination as being the internationally recognised right and ongoing process of Indigenous people to collectively determine their own pathway within and outside of settler societies. So the first step was to identify the international evidence and looking for models of Indigenous people's inclusion in policy processes. I looked at New Zealand, Aotearoa, and Canada and Australia. So the objective was to examine the processes of including Indigenous peoples in policy development processes for evidence of self-determination to inform alcohol policy development. So a search of peer-reviewed literature identified 20 papers that described their inclusion of Indigenous peoples in policy. And these were coded against 4 domains describing their inclusion. Indigenous representation, so looking at who was included, the stage of inclusion, so when, the method of inclusion, so how, and the reason for inclusion, the why. And we found that participation and inclusion of Indigenous peoples did not equate to self-determination. So there was no single approach that just suddenly resulted in self-determination. And I think the key to the definition of self-determination is that Indigenous people are the ones defining their involvement in policy processes. And it cannot be decided by someone else. And what was interesting is while contentious, treaties provide a precedent for Indigenous people's inclusion in some processes, and that facilitates and enables Indigenous peoples to influence processes. So the next step was to look at what expert opinion said was needed. So I used elements that we identified in this review as a starting point. I looked at who was included, ways Indigenous people were included, and stages of Indigenous people's inclusion. So, and the purpose was to provide a framework and develop a framework. We used the Delphi technique to seek consensus on based on the perspectives of a panel of experts. So 20 panellists, 9 First Nations Australians, 11 non-Indigenous. They came with massive experience, at least 170 years of combined experience in Aboriginal community-controlled organisations, and more than 200 years experience of and be able to influence policy on national as well as state territory level advisory committees. So Adelphi is a multi-stage iterative series of surveys which were repeated and takes a opinion and turns it into consensus, or seeks consensus from those opinions. The data was collected using electronic surveys across 3 sequential rounds in September, October and December of 2020. So the first finding was that there was almost total consensus on the need for First Nations Australians to be included at all stages of policy development, as we see across the bottom of the screen, from agenda setting through to the monitoring and evaluation. There was one panellist who said that Indigenous people shouldn't necessarily be included in the monitoring or evaluation phase, but I think that was more around, they emphasised the need for independence in the monitoring and evaluation. So good research tells us that First Nations Australians should be involved in any research that affects them. So it doesn't necessarily, I think they were emphasising the need for independence from the community that's affected. And the first round was a qualitative round. So the panellists were asked to identify what they saw as necessary for First Nations Australians' self-determination in alcohol and health policy. And I then analysed that, and there were 6 main themes or areas where self-determination was needed, and under those a series of elements. And these themes recognised that there was a need for change in the development and implementation of policies with First Nations Australian communities. And this change needed to happen from a macro level, because we needed government support and changes, so things like a treaty or constitutional recognition. They identified values that should underpin the entire process. There were some really specific elements around the actual policy development process. There were elements that related to the decision-making process within policy development processes. There was discussion around who should be involved, so representation, which linked back to also the previous study, and the essential elements for implementation, that when you're implementing policy, what needs to happen. And these themes became the questions for the following 2 rounds, and all the suggestions or elements underneath them were what was ranked. So overall, in the 6 questions, there were 65 elements identified. So in stages 2 and 3, panellists were asked to rank these on a scale of this is not self-determination, right through this is necessary for self-determination. And if there was a consensus across the panellists in their ranking, whether it should be included or right at the other end, we were looking for 80% agreement. And if that was the case, then the element was included. And we had agreement on the ranking of 43 elements across the last two stages of the survey. One area where there seemed to be very little consensus was representation. So panellists in the last round were asked to categorise each type of representation into one of 3 categories: to include depending on the context, and inclusion is not self-determination. And while just 2 elements had more than 80% consensus or agreement, and they have to be coded as being, or as always include, so that was community-controlled organisations and from affected communities. There were 8 other elements that were split across always include and include depending on the context. And these aren't actually mutually exclusive. So again, so there's great variation in who should be included and who should represent voice, or whose voice should be heard in the process. And interestingly, there were only 2 that did not fall into that category, and these were those elected to government and public servants. Now, these people, First Nations Australians in our state, federal, territory governments are really important, as well as our public servants. However, the question was whether this equates to self-determination. And I think their roles are really important and vital, as we've seen play out in the Northern Territory quite recently. But they're not there to represent First Nations Australian communities, and they actually have other responsibilities they need to balance. So that sort of role, it came out clear. So just they're very important, but not they don't equate to self-determination. And while I can't present all the elements, these are some of the elements where there was agreement. So a snapshot from each level. So federal level, there was need for change across the government and policy systems to address and remove some of the barriers that affect the determinants of health, so structural and social determinants. That in the policy process, that the value underlying the process should be that it's informed by the priorities and needs of First Nations Australian communities that are affected and being impacted, not those of policymakers. That the policy process should include First Nations Australians in design, co-design and the co-development of policy, which is a term that's being used a lot now. That when decisions are being made about this, that First Nations Australians should be included, and that the implementation process is actually really respectful of the priorities of First Nations Australians and their communities. So the next step was to consider the degree that First Nations Australians' self-determination was evident in the context of alcohol policy in the Northern Territory, specifically Mparntwe or Alice Springs. So the elements were identified in Delphi study were operationalised into a framework. I think about 5 levels, and there's about 36 elements there because there's some overlap. Then I used this framework as a lens to analyse qualitative interviews that I did with First Nations Australian community members in Central Australia. There were 21, and I tried to assess the degree of self-determination that they experienced as participants or recipients of the current alcohol policy. The interview transcripts were reviewed against each element of the framework and then coded as being present, and they were green, absent, they're coded as red, or if they're just mentioned, so neutral. Therefore, so creating a bit of a traffic light system, as can be seen from the image. So there wasn't a lot of green in the process. So some of these, I can't go through all of them, but if we looked at values underpinning the process, and it's driven and directed by First Nations Australians' leadership and governance. One particular community leader, an Aboriginal woman from the area, she spoke about how to me, I coded this as being absent. She said that we've left them behind. They've become the recipients of the policy, and the data is a way of driving policy change. And I think it's really healthy to try and find and facilitate a way of having input. So she spoke about ways that this could happen. At the next level, we had that First Nations Australians should actually be involved in the decision-making processes. Another community leader, Aboriginal woman, also said which voice is going to be heard. It's complex. There's no one institution is ready to and is really going to be able to address the situation. And it means that people have to come together. And I think that highlights the diversity of what we see as a community. So an interview with some Aboriginal men that ranged between, I think, 20 and someone close to the 70s. And they highlighted that Aboriginal men have been excluded from being a part of the process, mainly because they don't want to talk to white people about their drinking. Men are powerless in the way the policy is being developed. I was really grateful that they came forward and were willing to be a part of the study. The way that policy is made needs to involve First Nations Australians. So another community leader spoke about how they had workshops on the policy and actually worked out as an organisation what their views would be, what their opinions of the floor price were, and how things were what was good and what needed to be changed. So that was a really positive evidence of actually that there was a pathway. But many others felt that they were excluded. And I think this is where there needs to be a much greater facilitation of this sort of thing, that they don't talk to people. It's not hard to sit down and talk to people because we've all got the same problems. We've all got to go and work with everyone to make the place a better place to live. So overall, this analysis highlighted the absence of First Nations Australian self-determination in the alcohol policy context. And I actually want to explore more actually how could we actually improve this. So I looked at the final study explored how First Nations Australian self-determination can be part of the policy processes from the perspective of those being affected. So there were two objectives. I used semi-structured interview schedule and a really strong yarning approach. So the participants actually led the direction of the interviews, and they focused on their experience of past and present alcohol policy in the Northern Territory. There were 24 interviews with 21 First Nations Australians. These were done one-on-one to 14, and then there were 4 group interviews ranging between 2 and 4 participants. Then I thematically analysed these. So there are 4 main themes that were evident in the exploration of the topic of alcohol policy. as mentioned before, the Stronger Futures legislation has elements that means 70% of First Nations Territorians are subjected to. And this is enforced a number of ways, including measures at, particularly in Mabantua, at the point of sale, where there are police, alcohol, liquor enforcement officers who screen everybody's identification prior to entry. Everyone's meant to be screened for 5 questions, but people's experiences vary. But this is also those living in town, only applicable to those living in town camps and Aboriginal communities. Under the Stronger Futures legislation, they are not allowed to possess or consume alcohol in these areas. And the 5 questions are your name, your address, where you plan to be drinking, if you're going to share it with anyone and who you'll be sharing it with, and if you are otherwise prohibited from purchasing alcohol, so if you're on the banned drinkers register or you live in one of these areas, and any questions about their identification. So you have to show identification. But as I mentioned, everyone's experiences are varied, and of the examples and the quotes I use, all but one of the participants mentioned either living in private rentals, therefore, or actually having their own homes and mortgages. So these women, they spoke of not necessarily knowing the rules and even had difficulty identifying what they were. And some of these experiences did not match that of the legislation. For instance, one of the women said, basically, it's just really intimidating. You tremble when you're going through the drive-through. You get a little bit shaken, your voice changes. And I said, yeah, and they look at you like you're an alcoholic, but you're just purchasing it. It's Friday. I've been to work. Just want to have a drink. The first thing what some of them say to you is, it's against the law to be lying to us. That's really frightening. And they feel there's no capacity to actually question. And my understanding is there's no defined limits on the amount of alcohol that can be purchased and takeaway. One of the women said, I just want to know. I've tried to look up the Liquor Act, and I was told that I could only purchase 1 carton or 1 bottle in one day, and that was it. But I couldn't find anything in the Act saying that. And another one says, I don't even know what the laws are, I mean, when we go to question why, what are our rights? What are rights as human beings and buying alcohol? Yes, these participants had mortgages. One had to show her rental agreement to prove that she didn't live in this property. This is all something that everybody, and there was also some real inconsistencies. There was a white woman, she's like 5 or 6 metres away from they're walking to the bottle shop. She got into a bag to pull out a wallet to get her ID, and he's gone, no, you don't need that. And this Aboriginal man said, hang on, if I did that, I couldn't do that. And they all spoke of police only asking Aboriginal people for identification. And I think the biggest take home from this was that there's really poor implementation and communication of the current legislation. Participants aren't actually worried about necessarily the restrictions, but rather the discrimination they experience and the inconsistency of the approach of the liquor inspectors. And while these strategies are about enforcing supply reduction measures, First Nations Australian leadership seem to be absent from the perspective of these community members in the process. And I like this quote here around, we can sit down on the lawn and talk about why these rules are made for us. It should be the same for everyone, black and white. I think there's something about something really complex and simple at the same time. So while self-determination is recognised as being really important to improve the health and wellbeing, how First Nations Australians have been supported to action in alcohol policy development is limited. It is clear that First Nations Australians must be involved throughout the development of policy, but representation remains contentious as the views are diverse and as the communities and people involved. Our policy processes should be led and defined by First Nations Australians from the ground up. This can only be achieved when community priorities and voices are placed first. And this is quite challenging for national level policy or even territory level policy. So for this to happen, relationships with First Nation Australian communities need to be prioritised and their diversity recognised. And with meaningful community engagement and involvement throughout the policy development process, community ownership can be created. And self-determination is a right, irrespective of the current policy context. But the wider policy context and the place of First Nations Australians sets precedent for this. And presently, self-determination, I believe, remains an aspiration. But it's been renewed for me in the last 10 days. But action still needs to be required. So, significance of this work. I think it's the first of its kind. It provides a tangible way for both First Nations Australian communities to assess the self-determination within their context, and provides a guide for policymakers on how they can facilitate First Nations Australians' self-determination. And the experiences of these participants highlight issues with implementation of the policy. The tool does require further development and refinement for specific locations and tools, but I think it provides a really strong starting point. So in summary, self-determination is vital to wellbeing. It's more than just including people in the process, and it's a right. And I think the approach, so taking the time to actually work with community, might actually be more important than the strategy. So here's some of the university requirements. It requires some authorship agreements. These have been addressed as this is part of the thesis by compilation. Attribution statements that are included in each of these papers, and at the introduction of the thesis, there's a table for each manuscript. Data is currently stored in de-identified, password protected on the NDRI server and the university hard drive, and all hard copies have been are in a lock cabinet. And as per the data destruction agreement for the universities here, the data will retained for 7 years after the publication and the finalisation of the work. And collaboration, this data will only be accessible by the research team. I'd really like to acknowledge my supervisors and co-authors. Dr. Martin Simons was a co-author on the first paper, but acknowledge Professor Steve Alsop, Associate Professor Michael Wright, Professor Anthony Shakeshaft, and Professor Kylie Lee for all of their support and guidance throughout this process. And I'd also just like to acknowledge the CRE chief investigators who have really been really supportive of all of us coming through the Centre for Research Excellence. My fellow scholars who've come through the Centre for Research Excellence in Indigenous Health and Alcohol. The time and the support from my Delphi expert panellists, and all of my interview participants. And just leave you with these quotes, one from one of my participants. So we've had a lot of people talking and making decisions on behalf of blackfellas. We don't want that anymore. And I'd already decided to do a framework when June Oscar came out with this statement early in 2020 that when our voices are absent from the frameworks are made for us, it undermines us. So as long as the processes are defined by the government and First Nations Australians, we don't have a place, we will not have self-determination. And that recognition of this right to self-determination, not just the principle of, is vital to improving their health and wellbeing. And recognition, along with community-led approaches, and embedding of this right within state and federal governments, including the constitutions, are key. So thank you.